How much do you really know about fatty liver disease? Ever heard of it? It's a condition that's been gaining attention in the health world, and for good reason. Fatty liver disease, as the name suggests, involves an accumulation of fat in the liver. It's a common condition, but one that can have serious implications for health. There's a particular type of fatty liver disease known as non-alcoholic fatty liver disease. This isn't caused by alcohol, as you might have guessed, but rather by an excess of fat in the liver. In those with this condition, there's a significant increase in the amount of fat produced in the liver. This fat isn't just sitting idle. It's actively contributing to inflammation and other health issues, even potentially leading to conditions like cirrhosis, which is serious liver damage. Now you might be wondering, how does this excess fat get into the liver? Enter de novo lipogenesis, the process that's largely responsible for the fat in your liver. This complex term, de novo lipogenesis, might sound intimidating, but let's break it down. It's essentially the creation of new fat from sugary substances like glucose or fructose. Picture this: you're enjoying a sweet treat, a piece of cake, or a fizzy drink. The sugar in these treats, primarily glucose and fructose, is ingested and enters your system. These sugars aren't problematic on their own, but here's where the liver steps in. Fructose, unlike other sugars, has one unique characteristic. It can only be metabolized by the liver. This means that every bit of fructose you consume goes straight to your liver, where it's processed. The liver, in its quest to manage this influx of fructose, converts it into fat via de novo lipogenesis. But it's not just fructose. Even carbohydrates, which we often consume in large quantities, can be turned into new triglycerides in the liver. These newly formed triglycerides can cause liver problems, contributing to inflammation and even cirrhosis, a condition that sees healthy liver tissue replaced by scar tissue. So you see, de novo lipogenesis is like a factory inside your liver, churning out fat from sugars and carbohydrates. But unlike a factory, there's no off switch for this process, and the production line keeps running, accumulating fat in your liver. So the question becomes, how can we reverse this? The answer lies in what you consume and when you consume it. Now let's delve into how reversing fatty liver disease naturally is within your grasp. Reducing your intake of sugars, particularly glucose and fructose, can significantly decrease liver fat and help turn the tide against fatty liver disease. Why is this so? Well, remember that these sugars are the primary culprits that trigger de novo lipogenesis, the process where your liver converts sugars into fat. So by cutting back on these sugars, you're directly curtailing the creation of new fat in your liver. Research supports this strategy. Studies demonstrate that a diet low in sugar is a powerful tool in reversing fatty liver disease, showing promising results in both teenagers and adults. This is not just about cutting back on the sweet stuff, but also about embracing a diet that's lower in carbohydrates, another source of glucose. But there's more. Introducing periods of fasting into your routine can also make a difference. Known as intermittent fasting, this practice gives your liver a break from the constant onslaught of sugars, allowing it to process and eliminate stored fat. Some studies have even shown that this approach can reduce liver fat by over 50%. Remember, a healthy liver is a happy liver. Make the right choices and you can reverse fatty liver disease naturally. For more health tips, subscribe to our channel. Having understood how fatty liver disease can be reversed naturally, it's time to take action. It's not just about knowing, it's about doing. Start today by making conscious decisions to reduce your sugar and carbohydrate intake. Consider incorporating intermittent fasting into your routine. Remember, every small step counts. And don't forget to consult with your healthcare provider before making any drastic changes to your diet or lifestyle. The journey to a healthy liver begins with you. Stay motivated and persistent, and you'll see the change. If you found this information valuable and want to support our mission to spread health awareness, please subscribe to our YouTube channel, like this video, and share it with your friends. Your support helps us create more educational content like this. Thank you for being a part of our health-conscious community.